So in this table, we are going to discuss or overview about the psychiatric medication or mental medication, right? So the first one, it is called anxiety medication, anxiety or benzodiazepam. So benzodiazepam, we used to treat the anxiety, okay? So there are a group of benzodiazepam we use as an anti-anxiolytic, right? So the medication that end with zepam, like alprazolam, clonazepam, diazepam, lorazepam, they are the member in benzodiazepine. So the most common use is called alprazolam. What are the other benzodiazepam? Like diazepam, lorazepam, clorazepam, or chlordiazepoxim. So I said the medication what is end with zepam, they are the member. There's some few example like clonazepam, lorazepam, or temazepam. They are also in this group member. So the common indication of benzodiazepam basically we use for anxiety or seizure. Seizure means involuntary movement of muscle or muscle spasm, alcohol withdrawal syndrome, right? Or we use to induce or maintenance of anesthesia. The mode of action of benzodiazepam, they increase the GABA effect in the central nervous system. The common side effect of benzodiazepam, the common side effect, I said, sedation and amnesia. Amnesia means loss of memory. But here I could share with you the common side effect of benzodiazepam, easy way to remember A, B, C, D, and S. A stand for alter the vital sign. So if you give your patient benzodiazepam, patient develop bradycardia or blood pressure go down. So vital sign is alteration. So altered vital sign. A stand for altered vital sign. B stand for blur of vision, blurring of vision. C stand for constipation or confusion. D stand for dry mouth or dizziness. And last one, S stand for stasis of urine or retention of urine and sedation. So the easy way to remember from today, ABCD. ABCD also the side effect of anxiety or antidepressant like SSRI. Serotonin, selective serotonin reuptake inhibitor, also has a common side effect, ABCD. What is ABCD? We discussed few seconds ago. And also the other antidepressant like monoamine oxide inhibitor like phenylazine also has a common side effect, ABCD, right? So now I'm going to explain what are the key points about benzodiazepam or alprazolam for NCLEX keynote. The keynote for NCLEX board exam, I said, benzodiazepam only use for short term, right? Do not discontinue abruptly, right? So they are very addictive. So it is good to use for short term use only, and we never stop this medication suddenly or abruptly. If you give this medication as a RN or LPN, we have to monitor the respiratory rate because they can chance to develop respiratory depression, right? So let me recap it, the NCLEX key point here. So benzodiazepam, especially diazepam or flurazepam or lorazepam, it is good to use for a short time because they're highly addictive. Also safe in elderly patient rather than to use the haloperidol, what is atypical antipsychotic. If your patient take the benzodiazepam, we could monitor the respiration because this medication can cause respiratory depression, and also it is good to monitor liver function test. Benzodiazepam we can also be used for anticonvulsant or sedative effect. They have a sedative effect, so we use for insomnia or we use for a use as a muscle relaxant. If any patient has a overdose of benzodiazepam, what are the antidote we use? The antidote is called flumazenil. So flumazenil is an antidote we use for the patient if any overdoses occur. So now the second one, anxiety medication but atypical. This is the anxiety medication is typical benzodiazepam, but atypical anti-anxiolytics called Buspirone. Here you can see that a typical antidepressant is called bupropion. So this is bupropion and this is Buspirone. Don't miss these two terminology or two drugs. Let me explain about Buspirone, what is atypical anti-anxiolytics. The indication of Buspirone for anxiety or panic disorder or OCD, obsessive compulsive disorder or PTSD, post-traumatic syndrome disorder. The common side effect of Buspirone little bit different than benzodiazepam. They can cause dizziness, nausea, and headache. The key point about Buspirone for NCLEX board exam, what you must know, the Buspirone is good over benzodiazepam. Benzodiazepam can cause sedation, but Buspirone does not produce sedation, so no sedation. Dependency, not like the benzodiazepam. So benzodiazepam we use for short-term use because highly addictive. To overcome that kind of problem, we advise our patient to use the Buspirone because less dependency, and patient can use Buspirone for a long time. This is the advantage of atypical antipsychotic. Also full effect not felt for several weeks. So if your patient took this medication for 4 to 6 weeks, then they can get the effect of medication and advise your patient take with meal to decrease the GIT upset, right? So let's go to explain another medication we use for anxiety and depression together, right? So this medication is called SSRI. So SSRI means selective serotonin uptake inhibitor. So it is, you see, selective serotonin reuptake inhibitor. So these drugs inhibit the reuptake of serotonin. Okay. So the medication we use as a SSRI example is fluoxetine or sertraline, right? Or another name is called citalopram or paroxetine. So this medication help you to keep the serotonin in the body and which makes you happier. Depression patients are very sad, right? They cry. They do not, they are sad, they feel empty, no pleasure in life, crying, not eating, body weight loss, fatigue. Their mood is switching. So all are negative effect. But when serotonin in the body is longer because of SSRI, which makes the patient happy. So example of SSRI are fluoxetine, sertraline, paroxetine, and citalopram. So indication of SSRI are and anxiety, depression, or OCD and PTSD, right? OCD stand for abstract. Sorry. So then other indicator of this medication, I said like here, I said citalopram we can use for sedation as well. So antidepressant, especially SSRI, can cause suicidal ideation. If your patient take SSRI, then you could monitor them because it causes suicidal ideation, especially in the children and adult, and may take up to 4 to 6 weeks to work. Do not give with disulfur, but can be given at the evening, this medication. Also avoid the alcohol and disulfide together. A common question NCLEX board asks, SSRI and monoamine oxidase inhibitor never ever give together. So keep in mind, all SSRI can cause serotonin syndrome, which is a side effect, or serotonin overload if too much of the drugs is given. Also, SSRI never given with MAO inhibitor. right? So now question come, how SSRI work? Mode of action. They inhibit the serotonin reuptake. The common side effect is like benzodiazepam, they have a ABCD, right? And what is the meaning of ABCD? We already discussed. Other side effect of SSRI, they can cause sexual dysfunction, weight gain, and insomnia. Okay, and cause insomnia, I said. So to avoid the insomnia, it is good to give this medication at the evening, not in the sleeping time. Okay, so now here the key point. Okay, the key point about the SSRI are, so if you give the SSRI to the patient, they have a common side effect, has they can cause sweating, dizziness, and headache. And also watch for serotonin syndrome. So what is serotonin syndrome? Serotonin syndrome means if you give too much SSRI, patient develops some sign and symptom, and they are agitation, hallucination, diaphoresis, and tremor. Agitation, hallucination. Hallucination means sensory perception, abnormal belief, right? Patient body temperature increase and excessive sweating, and also the tremor. All of that sign symptom is together is called serotonin syndrome because of the SSRI, or like the Prozac or fluoxetine, citalopam, they can cause serotonin syndrome. And do not take with St. John's wort. So St. John's wort is a herbal medication. So St. John's wort and SSRI never ever give together. Also, SSRI never give with monoamine oxide inhibitor, right? So during as this increase the risk of serotonin syndrome, also full effect not felt for up to a month. So 4 to 6 weeks need to start the function. Let me recap it, my friend. We do not take the SSRI with herbal medication, especially St. John's wort. If you take both together, I mean St. John's wort and SSRI, increase the risk for serotonin overload, which is called serotonin syndrome. Serotonin syndrome is a group of combination of some sign and symptom like agitation, sensory perception or hallucination, increased body temperature, and increased excessive sweating or diaphoresis, right? So the next medication we use, it is called depressive medication, or medication we use for depression. The most common one is called TCA. T stands for tri, C stands for cyclic, A for antidepressant. The most common medication in this group are amitriptyline or imipramine. Most common medication we use here. So What are the indication of amitriptyline or imipramine or TCA? We use it is for depression or some neuropathy, right? And also we use for fibromyalgia or anxiety and insomnia. These are common use of TCA. So the TCA or tricyclic antidepressant has a common side effect. They can cause sedation or orthostatic hypotension. So educate your patient, if they take this medication, slowly change the posture. Also, anticholinergic side effect. What is anticholinergic side effect? Patient develop urinary retention or stasis, constipation, dry mouth, blur of vision, and photophobia. Also, patient develop tachycardia. So all of these sign symptoms together we call anticholinergic side effect. The key point for NCLEX board exam about the TCA. So to counteract anticholinergic effect, we give the patient like chewing gum or chewing gum to prevent the dry mouth, wear the sunglasses to prevent the photophobia, right? And also give them high fiber containing diet, also increase the fluid intake to prevent constipation. The another group of drugs we use for the depression, and that is called MAOI, right? MAO inhibitor. M stands for mono, A stands for amine, O stands for oxidase, I for inhibitor. So monoamine oxidase inhibitor. So these drugs blocks the MAO enzyme that breaks down epinephrine or dopamine, even serotonin, which lead to depression. So if this enzyme inhibit, they stop to the breakdown of epinephrine, dopamine, and serotonin. They also block the tyramine, which put the client at the risk for hypertensive crisis. The example of monoamine oxide inhibitor are phenylzine. NCLEX board sometimes asks the other drugs what we use as a monoamine oxide inhibitor. So it is called Marfen, Nardil, and Parnet. Easy to remember, Mar, Nar, Par, Marfen, Nardil, and Parnet. So keep in mind, not used as often due to the various drugs. We usually, that type of medication we do not use because these drugs can interact with other drugs and also interact with some food, right? It is very important. So here, the common side effect they cause is irritation, anxiety, orthostatic hypotension, and hypertensive crisis. Most important, right? If you give some kind of food like tyramine containing food, that times they cause hypertensive crisis. On the other hand, the easy way to remember the common side effect of MAO inhibitor A, B, C, D, right? So as I told you, A stands for altered vital sign, means decrease the heart rate, blood pressure, and pulse rate. B stands for blur vision, C stands for constipation and confusion, and D stands for dry mouth. It is the common side effect for MAO inhibitor, SSRI, benzodiazepam. So most common monoamine oxide inhibitor are phenylzine we use for depression. What are the keynote for NCLEX board exam? They interact with many other medication, including over-the-counter medication or cold medication, which can result in severe hypertension crisis. Also, if your patient take monoamine oxide inhibitor, tell them never to take with any other antipsychotic medication, right? Especially with SSRI. SSRI and MAO never ever together. Also, some kind of food you have to avoid if your patient take the monoamine oxide inhibitor. What it is? The food rich in tyramine. What are the food rich in tyramine? A, B, C. A for avocado, B for banana, C for chocolate, C for aged cheese. Also red wine, salami, and pepperoni. So I said tyramine restricted diet. Easy way to explain, some organ meat, some preservative meat contain tyramine. Some kind of grain, especially the yeast, contain tyramine. Some kind of vegetables like banana, avocado, raisin, right, contain the tyramine. Some dairy product we better to not to take, like cheese, but except the cottage cheese. Also no yogurt, no coffee, no tea, or no chocolate, no soy sauce. I want to recap two things. The MAO inhibitor not with the tyramine food. MAO inhibitor take time to start work, usually 4 to 6 weeks. And MAO inhibitor never take with SSRI. So the other group of drugs we use here, antipsychotic, mental medication for the depression, but atypical. So it is the depressive medication. You see, there are depression. This is TCA. These are typical. If TCA is not suitable, we move on, we switch on the MAO inhibitor. It is also typical depressive, but some are atypical antidepressive, which is called bupropion. So the indication of bupropion, depression, and also use as aid to quit smoking. Like you are a chain smoker, if you want to stop the smoking, better to try bupropion. Bupropion has some side effect, like they cause insomnia, headache, GI upset, weight loss, hesitation, and involuntary movement of muscle called seizure. Here I left some note about the medication, what is frequently board asks. NCLEX board. Antidepressant, right? Like trazodone. The major side effect of trazodone, they cause sedation. Another medication we use called serotonin non-epinephrine reuptake inhibitor is shortly called SSRI. SSRI already we saw it is, I mean, antidepressant, but here it is SNRI, serotonin non-epinephrine reuptake inhibitor, right? It is a little bit different than SSRI. So there are some example I left here about SSRI or SNRI. So SNRI we use for anxiolytic or anxiety. So like duloxetine. Duloxetine is a selective serotonin and non-epinephrine reuptake inhibitor, shortly called SNRI, that can use to treat depression, but also can be used to treat pain associated with diabetic neuropathy. And duloxetine is used to treat depression, but can be used to treat pain that occur in the people with diabetes. So this is the same information I left 2 times. Little bit language is different, but absolutely same. Now go back a little bit here. Some important commonly asking in NCLEX board about SSRI. The example of SSRI like fluoxetine, it is shortly called Prozac. Sertraline, it is called Zoloft or citalopram, right? Also paroxetine, citalopram, citalopram, right? And citalopram is Celexa, and it's called escitalopram is called Lexapro. So little bit information about the Prozac or fluoxetine. The Prozac cause suicidal ideation, especially in the children. Also, fluoxetine should given early of the day as it causes insomnia. And citalopram, this one, citalopram or Celexa, causes sedation. So after taking citalopram, tell your patient not to driving or not to do heavy machinery working, right? So Zoloft or Sertraline, it is SSRI. It is good to give at the evening time, and also cannot give with alcohol. Okay. The another drugs called SNRI. It is SSRI. It is SNRI. SSNRI stand for selective serotonin norepinephrine, and for norepinephrine reuptake inhibitor, most common example is called venlafaxine or efoxor. So they interact with lithium. So venlafaxine and lithium never ever together. Also, venlafaxine is commonly used to treat the anxiety. So it's this table we can get all medication together.